Assalamualaikum doctors. In this video I am discussing about syncope history. So syncope history comes on recently 2024, and how can we take the history? So syncope, the child in the school sudden become unconsciousness or fall down. These are syncope criteria is that we know that when a person lose consciousness and muscle strengthen comes and go quickly, does not last long, spontaneous recovery as no resuscitation required. So it's spontaneous recovery with a few moments. The history will ask onset, course and duration, what make it better and what make it worse. Is it first time occur or recurrent occur? Before what happened, like any fever, pain, anxiety, hunger, cough, pee, poo, recumbency, fear from something in front of others or alone, sweating, blackouts, tinnitus, hot weather. So the word I am telling, these are the syncope aggravating factor. So before that is happened or not. During what happened, any abnormal movement, blue lips, loss of control, fall on the ground. Okay, that is we will ask. Then after that, weakness, abnormal gait, confusion and injury. And previous similar attack, and is there any video recorded available or not? Other concern, any dysmorphic features. So before going to the systemic review, again I am repeating. So syncope history, first onset, course and duration, what make it worse and what make it better. Before what happened? Before is there experiencing any fever, pain, anxiety, hunger, cough, pee, poo, recumbency, fear from something in front of others or alone, sweating, blackouts, tinnitus, hot weather. During what happened, any abnormal movement, blue lips, loss of control, fall on the ground. After any weakness, abnormal gait, confusion and injury. Any similar attack and video records if available. Other concerns, any dysmorphic features. Now systemic review from CVS is very important. Any heart racing, awareness of the heartbeat, chest pain, exercise intolerance. So we need to exclude that it is any heart condition or not. That's why any chest exercise intolerance, chest pain. Now any neurological cause, CNS, we can ask like sign of increased intracranial tensions like morning vomiting, morning headache, abnormal movement, trauma, CNS infections. So these are CNS cause or not, we need to ask. Psychiatry like depression, anxiety, visual and auditory hallucination and suicidal attempt. So psychiatry we add there, that is any depression, anxiety, visual and auditory hallucination, suicidal attempt. Chest we ask like recurrent any bugs, cough, how many pillows used for sleep. GIT, poo, tummy size and tummy pain, urinary system, pee, blood pressure and blood glucose. Endocrine about any hot weather and numbness. MSK, skin spots, lumps, neck swelling, bone pain and hair loss. Hematology, any pale or blood from any orifice, bruises and recurrent bugs. And past history, as usual 5T IOA, like any trauma history, any traveling history, treatment taking or not, happen at home or not, drug taken for any cause a disease, any medication taking or not, previous any admissions, previous any surgery, these are we need to ask. Then pivotal, the pivotal like any puberty started or not, if girl menstruation is regular or not, boyfriend present or not, sexual activity, drug, alcohol, suicidal thoughts and self-harm. So these are heads history you need to exclude. Then perinatal, natal and postnatal history. Perinatal, natal and postnatal history is as usual we ask. Then allergy, nutrition, anorexia nervosa we need to exclude. How about eating and is there any consciousness about the shape of the body? By that we exclude the anorexia nervosa. Family modification, sudden and infant death, it's very important. Sudden and infant death, it is a red flag sign. Similar conditions, chronic any disease like long QT syndrome, diabetes mellitus, autoimmune disease, family history of any deafness. Family history of deafness because of Alport syndrome. Now social and psychological and impact, easy access to hospital. Differential diagnosis of syncope. So when a syncope history come, there is a differential diagnosis comes in your mouth. From CBS we can keep like arrhythmia, long QT and Wolff Parkinson White syndrome, atrial fibrillation, atrial flutter, heart block or structural any aortic stenosis, HOCM and myocarditis, coarctation of aorta. So any cardiac cause can be. We can exclude diet, exercise intolerance, chest pain. CNS breath holding attack. According to child 8, breath holding attack we can tell that. Breath holding attack or reflex anoxic seizure. Drugs like tricyclic, antidepressant, antihypertension, oral hypoglycemic, insulin addictions and sedatives. Metabolic about hypoglycemia. Non-cyanotic cause are vasovagal attack, postural hypotension and anaphylaxis. So many vasovagal attack actually they tell postural hypotensions and the anaphylaxis. We know that what is a vasovagal syncope. It is a temporary loss of consciousness and tone that occurs as a result of inadequate cerebral perfusions. Vasovagal syncope occur in response to a trigger with a corresponding malfunction in the parts of the nervous system that regulate heart rate and blood pressure. When heart rate slows, blood pressure drops, and the resulting lack of blood to the brain cause fainting and confusions. So that is vasovagal attack. And postural hypertension, we know that it is dropping in the systolic blood pressure more than 20 millimeter mercury and or diastolic blood pressure more than 10 millimeter mercury within 3 minutes of upright positions without moving. In anaphylaxis, also we know that it is a sudden reaction. It is an emergency reactions. One of the allergic reaction it is. So when we take history, every history, the red flags is very important. What is the red flags of syncope? We keep in our mind when we take the history. First of all, exertional syncope associated with swimming, loud noises, chest pain, palpitations, supine positions, known any congenital acquired heart conditions. So as usual, we ask any long chronic condition the child is suffering or not. By that heart condition we know. And chest pain, exercise intolerance is very important. Now, family history, it is important to ask sudden death at the age less than 40, inherited any cardiac conditions, any chronic condition in the family present or not, we ask, conduction disorders, early ischemic heart disease, age less than 30 years. Other characteristics are absence of prodromal any symptoms. So, myocarditis can be present, so any fever we need to ask, injury can be common. So, previously any injury, the child play injury. Next I will management from another video I will discuss. So this is all about how can we take the syncope history. And syncope definition I already tell that. How can we differentiate between the seizure and syncope? Okay, in seizure post-ictal phase, rigid posture, no incontinency. So that is not syncope present. In syncope, there is no any post-ictal phase, no any rigid posture or no incontinency. Pre-syncope symptoms sense that is about to pass out loss of consciousness. Pallor, dizziness, nausea, sweating, and loss of consciousness is less than 1 minute. The duration is very important in syncope, less than 1 minute. And there are some predisposing factor. I already tell that vasovagal attack. These are like a warm environment, crowded space, anxiety or sudden surprise, fright, blood drawing or sight of blood, prolonged or motionless standing on upright sitting, lack of sleep, dehydration, hunger, any painful or unpleasant stimuli such trauma, and severe menstruation cramps. So these are the predisposing factor of the syncope. This is all about syncope history. How can take? Thank you.